Good afternoon or good morning to you all, depending on where in Australia you are tuning in from. My name is Tara Simpson, and I am a member of the EAAA board. I wish to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, water, and culture. I pay respects to their elders past and present, and I'm joining you today from Ghana land in Adelaide, South Australia. Please feel free to enter into the chat the name of the land in which you may be working or living in, if you like. Welcome to today's Lunch and Learn session. These sessions are given to our members to provide them the opportunity to showcase their work and share their knowledge and experience with a growing audience of people from the sector and community members. Before we begin, just a couple of housekeeping matters. Please use the chat function to ask questions during the sessions, and as always, please keep interactions respectful to both the speaker and participants. At the conclusion of today's presentation, your questions will be presented to our speaker during the Q&A. Closed captions have been enabled for this session. If you need these, there is an option at the bottom of your screen in Zoom. The sessions will be recorded for the purpose of sharing the webinar with everyone who has registered, and it'll be on the EAAA website and on the YouTube channel. And finally, we would appreciate your feedback in the survey that will be sent to you at the end of the webinar. Now, to today's presentation, I am delighted to introduce Eleanor Beswick, who is an aged care advocate with the Seniors' Rights at Darwin Community Legal Centre. Originally from Scotland, where she studied sociology, Eleanor has spent the past decade living in the Northern Territory, including in remote communities across Central Australia and the Top End. Her work in Australia has spanned community service, supporting refugee families, young people in and out of home care, youth development in remote communities, and women and children experiencing domestic, family, and sexual violence. For the last 18 months, she's focused her efforts on aged care advocacy, leading outreach and systemic initiatives to address the abuse of older persons. Today, Eleanor will be speaking on older persons' abuse in the Northern Territory, a systemic advocacy journey. In this presentation, Eleanor will outline the landscape in the Northern Territory, where service gaps and the absence of clear frameworks make this issue particularly urgent. She will share the advocacy journey, including the preconception, challenges, and turning points that shape the project, and explain how momentum was built by establishing a network of services and creating a roadmap to implementing the national plan to prevent abuse and mistreatment of older Australians in the Northern Territory. Finally, Eleanor will reflect on the realities of working in such a unique environment, the lessons learned along the ways, and the opportunities that now exist for stronger advocacy, collaboration, and lasting impact. Please join me in welcoming Eleanor Beswick from the Darwin Community Legal Service. Over to you, Eleanor.
Hello, thank you, Tara, for that lovely introduction. I'll just share my screen so you can see my slides. Okay. My name's Eleanor. I'm a aged care advocate at Darwin Community Legal Service. I'd like to acknowledge the Larrakia people as the traditional owners of the Darwin region, where I'm coming from today, and pay my respects to the Larrakia elders past, present, and emerging. Now, just to let you all know that in the Northern Territory, we often refer to what is commonly called elder abuse as older person abuse. And this is to make the distinction that we're talking about all older people and not specifically First Nations elders. So I'll probably use these interchangeably during this session, but just, I'm talking about the same thing. So I'll just dive straight in. To give you a bit of background, Darwin Community Legal Service is a not-for-profit community-based organisation. We provide free and independent legal help and advocacy support to people in the top end of the Northern Territory. We have our general legal service, our tenants advice service, our disability rights service, after hours legal advice, and the senior rights service, of which I am a part of. So the Senior Rights Service provides free and independent aged care advocacy for older people residing in the top end of the Northern Territory. Our organisation is based here in Darwin, but our services visit regional and remote areas as often as we can, but we only have capacity to visit some communities and not always as much as we would like. Now I'm going to have to just kind of jump back and forward a bit chronologically, just so I can give you a picture of elder abuse in the NT. I kind of have to delve into some of the findings and data that we gained along the way in our work over the last few years. So I'll sort of give you that information up front, but then go back and tell you about how we got there. So from the research that DCLS has conducted, we found that 15% of senior Territorians experience older persons abuse. 70% of people experiencing abuse are women. The most common forms of abuse are psychological and emotional abuse, financial abuse, and neglect. 90% of perpetrators are a family member, and 44% are an adult child of the older person. Now, in our survey last year, we asked people if they'd ever experienced abuse from a family member, and that's where we got that 15%. But in our survey at the beginning of this year, we asked, had they experienced abuse in the last 12 months or prior to that? So we had 10.6% of people said yes in the last 12 months, and 9.6% said yes prior to that. And the table on the right there indicates the percentage of all respondents that picked sometimes or often when asked if they'd experienced each of those types of abuse. Now, just to compare them with our national statistics, so these are from the National Elder Abuse Prevalence Study, and you can see that the percentages for every type of abuse are higher here in the Territory. But some things to note are that most of our respondents here picked more than one type of abuse, whereas the national survey has said that most respondents picked only one type of abuse. Also difference is the higher percentage of women experiencing abuse in the Territory. The national study stated that only slightly more people experiencing abuse were women than men. And the other thing that we think is really relevant is this higher percentage of financial abuse in the Northern Territory. So 13.5% of all people surveyed said that they experienced financial abuse, which is a lot higher than the national figure. And we also have data from a 2001 Senior Safety Project by Quota that had 21% of all those that they surveyed responded that they had experienced financial pressure from family members requesting money and loans. So some systemic factors that affect that are risk factors for abuse in the Northern Territory are housing shortages, intergenerational trauma, overcrowding, remoteness, inadequate laws, and a lack of enforcement and lack of services and supports. So we have many remote communities in the Northern Territory, and they face complex challenges around geographical isolation, a lack of services, and a lack of resourcing. The National Elder Abuse Prevalence Study found that regional areas face specific challenges that require specialised policy, prevention, and service responses, which we don't have those in our remote communities up here. We've seen that older people are frequently required to share their pensions, food, and accommodation with other family members. Throughout my consultations, I met with Indigenous health services and councils that run aged care services in remote communities. And we heard from workers in residential aged care facilities that they were often asked by residents to hold on to their income management cards and debit cards because family members were coming round and humbugging them on pension day, and so they were wanting to have the staff hang on to them. The staff knew that like technically they're not supposed to do this, not by like their organization's policies, and also just like they don't really have any legal standing to hold on to people's cards. But they felt that there was, if they didn't, then residents weren't going to have any of their pension left for like clothing or tobacco or other items. We also saw in COTA's 2001 report that they did a consultation with Indigenous service providers in remote communities, where they found that financial abuse of seniors is a major issue in many remote communities, and that they were quoted as saying that sharing no longer has the reciprocity it used to have in Aboriginal society. One organisation stated that sharing no longer means the same thing in the context of addictions and substance abuse. That there is agreement that solutions to this problem need to be identified and implemented by individual communities and to be holistic, and that elder abuse is considered by many to be a consequence of social and economic disempowerment of the whole community. Now, this is not to say that we're only seeing older persons abuse in remote communities. We're seeing it across all geographical locations and communities in the Northern Territory, and I'll give some more examples as we go through. So some individual risk factors for abuse are being of advanced age and physically frail, living with cognitive impairment, being socially isolated. There are factors associated with carers. So we use this term carer stress and burnout. We know that there are many cases where a family member takes on the responsibility of care for an older family member, and they don't fully understand the impact it's going to have on them. They feel overwhelmed. They've got a lack of training in providing care. They don't have enough support. In terms of residential respite, we have such a shortage of aged care beds in the Northern Territory that almost no residential aged care beds are allocated for residential respite unless facilities feel like that's going to turn into ongoing residential care. So respite for carers is very hard to come by. There's also financial pressure. Sometimes carers have to lessen the amount they work or give up work altogether to provide care, and this can cause financial dependency on the older family member, which can cause resentment or what we call inheritance impatience, where because they're providing care, they feel like the older person's resources already sort of belong to them. We know that mental illness, substance abuse, and problem gambling are risk factors for abuse, as well as a history of conflict or violence within the family. So Darwin Community Legal Service facilitates the Older Persons Abuse Information Line in the Northern Territory. We've been running this for quite some time. Sometimes it's been funded by the government, sometimes it hasn't. In the most recent period, it's been funded by NAB Bank. This table is just from our most recent period, and it shows sort of what proportion of calls we get from different sources. So we get calls to our line from family members, friends, carers, neighbours, aged care workers, social workers, police, as well as older people calling for themselves. So if somebody's calling with concerns for another person, we can talk them through calling police to make a mandatory report, requesting a welfare check from police if that's needed. If there's concerns for safety of the older person, we'll suggest connecting them with the Domestic and Family Violence Service for risk assessment, safety planning, and ongoing case management. We'll talk to people about the Civil and Administrative Tribunal, NTCAT, and the Public Guardian and Trustee if there's concerns for an adult guardian misusing their position. We'll also give them information about available services. If the caller is the older person themselves, we can offer them direct advocacy support from our service with things like safeguarding finances, changing bank accounts, adding withdrawal limits, implementing Centipay. We can help them through the process of writing advanced personal plans, which is the Territory's version of enduring powers of attorney. Our legal service can help them with adult guardianship issues and with domestic violence orders, and we can refer them out to other services that are appropriate. But we're not, however, funded to provide ongoing and intensive case management support as would be appropriate for someone experiencing older person abuse, as we only have a small team of advocates. whose main role is aged care advocacy for the whole of the Top End region. So as you could see from that previous table, only 27% of the calls that we received were from the older person themselves. And we know that there are many complex reasons why people might not seek support or might not feel that they can report abuse. In our most recent survey, we asked respondents, did they ask for help? And more than 50% of people said no, they didn't ask for help. And when we asked what was the main reason that prevented them from getting help, the biggest reason was that they care for the abuser, followed by fear of the abuser, and that they're dependent on the family member or relying on them for certain things. So just as some case examples, we got a call from an older person whose adult daughter had moved in with her along with her partner and their children. This had happened because the adult daughter was experiencing financial pressures. They'd lost their job due to substance abuse. The person that was calling us said that they felt under siege in their own home, that they were experiencing verbal abuse and emotional and psychological abuse from their daughter. They said that the family was utilising all their resources, they're having to pay for everything, and they were just kind of at the end of their tether. And so I spoke with this person about kind of, what supports we might be able to provide and what options they had and what potential legal options they had. But she said she didn't want to evict her daughter because she didn't want to make her grandchildren homeless. And she didn't want to make things worse because she knew that there was, issues going on for her daughter. And she was also concerned that if she confronted things, that they might stop her from seeing her grandchildren. And she also said that she felt like a lot of shame in talking about her daughter's behaviour because, she's raised this person and now they're behaving so badly towards her. I guess, for her, she was able to talk through things with someone and to know that there were supports available should she like to use them, but for her, she didn't feel like she could take any action at that time. Another example is we had a call from somebody with concerns for their mother. They noticed that there were large transfers of money going from the mother's account to a sister's account, very large amounts of money. And the family were confronting the sister and they refused to talk with them or to address the issue. And the rest of the family were trying to persuade the mother to go to the police or go to the bank. But the mother had really clearly stated she didn't want to contact police and she didn't want to contact the bank or involve any services because the daughter is caring for another family member that has disabilities and requires full-time care, and she didn't want to get them into trouble. So I guess these are both examples where there were reasons that prevented the people from reporting abuse. And we hear quite often some care is better than none. So there are situations where a family member might be being abusive towards an older person, but they're also providing some level of care, which is enabling that older person to remain independent in their home. And so they don't want to jeopardize that. So we also asked people, who did you ask for help? And you can see there's kind of a wide cross section there. And in fact, the biggest column is other. So people are obviously talking to lots of different people. And we've got police and the doctor there as well. And we saw that from our first survey as well when talking to people specifically that the GP is a really big port of call for older people, that the GP is like a trusted professional, someone they see fairly regularly that they think would have information and advice for them. And so I guess from that, we know that if we were going to do some like targeted education with stakeholders, like GPs might be a really good port of call. And we asked, what help did you receive? And almost 40% said no help. And we asked, was the issue resolved? Has the abuse stopped? And almost 70% of people said no. I guess this really just highlights the gaps in the fact that there are still a lot of people in our community that are suffering and that are not being supported. So this table shows the referrals that we make. And as you can see, the highest number of referrals we make is to legal services. So there's almost always some legal issues involved in older persons abuse, and legal support and advice is usually required. And in cases, like we said before, there's a high risk, we'd refer to police and domestic and family violence services, other community services, public guardian and trustee, and things like that. So who can act? If someone calls us with concerns about an older person, as an NGO, we can only give advice and information unless the older person themselves wishes us to provide support. And this isn't always understood by other services or members of the public. People assume that in the way that people can report child abuse and it'll be investigated independently and actioned, that this is the case for vulnerable adults. But in the Northern Territory, we do not have a way to make those sorts of reports, and we do not have an agency to investigate. So if there are barriers for someone seeking support for themselves, such as cognitive capacity, language, or fear of the abuser, nothing might happen until the situation declines to the point of emergency services becoming involved. Police generally see elder abuse as a civil matter and will only intervene if there's a risk to safety or there's physical or sexual abuse, which, as we've seen, are the most prevalent forms of older persons abuse. And the public guardian and trustee can intervene on behalf of people with impaired capacity as a last resort if there's no suitable decision makers, but they don't have the same investigative powers as, say, QCAT or bodies in other states and territories. So to give you some case examples, we had a referral from police. They were contacted by an aged care provider who wasn't able to gain access to a client for some time. Police went to do a welfare check, and when they got to the house, the neighbour said the same. They hadn't seen the elderly couple that lived there for a while. So police forced entry to the house. They found the adult child there very angry and uncooperative that police had entered. And they found the older couple really disoriented, not in a good state physically. One of them had wounds that they were worried about. So they called the paramedics, and the paramedics attended and said to police, look, we think that this is elder abuse occurring here. And so police sent us a referral through SupportLink, which is like a online referral platform in the Northern Territory. So all we had from that was a landline number to contact people. So we contacted that multiple times with no luck. And we had to then return this referral to police and explain there wasn't anything further that we could do. And we actually made this slide and the next slide for education for police around this to show them that, you know, there's family violence reported, police attend, they make a SupportLink referral to an NGO, and then there might not be consent or a way to actually contact the person, and then we can't proceed from there. And just like as another example, so we had a call from an aged care provider. They'd had workers reporting to them that their client's son had moved onto the property with her, and they were worried that she wasn't getting access to food or her own money. And they weren't sure what to do. So we were telling them about mandatory reports and police and guardianship and things like that. They said that they'd get back to us when they'd spoken to the older person, but when they did get back to us, the older person had actually had to be taken to hospital and was in a hospital. And they said that they'd pass our details on to the hospital social workers, and we didn't hear anything further from that. So what we're seeing in some cases like this is this unfortunate trajectory where things are so bad that emergency services are attending. There's hospitalization. There's no safe discharge location. There's no residential aged care beds. There's long-term hospitalization leading to a rapid decline in health, and sometimes leading to people passing away in hospital, which is a really terrible state of affairs that we're in. Yeah. So in 2023, the Northern Territory Government, through the Office of Seniors, originally funded a one-year project for DCLS, for the Older Persons Abuse Outreach Service, And this is where I specifically, where I began working in this area. And that funding was then extended for second year. So I just sort of amalgamated our first and second year's kind of main objectives there. But I guess at the beginning, like having worked in the DV sector for some time, I kind of felt like I had a pretty good understanding of the available like services, legal options, escaping violence payments, about the domestic family sexual violence frameworks and action plans for the NT government, like how the sector work with the government, both on individual cases and like systemically. But I didn't have that same level of knowledge when it came to older persons abuse. So I started doing some research. I read every report I could find. I was looking at national reports, some plans, reports on elder abuse in remote areas. I found the Australian Institute of Family Studies 2018 Elder Abuse Report, and that has this table in it which shows each state and territory, its guiding legislation, and the agency responsible for their response to older persons abuse. And the Northern Territory was at the bottom of this table, and it just had a dash in each column to mark that we don't have anything. I thought, this can't be right, surely, like, maybe I'm just not finding stuff. There must be more out there. Like, I'm not a lawyer. I don't have that legislative experience. Like, so I kept reading through stuff and looking at our NT domestic family sexual violence reduction framework. And that only has a couple of references, like one to abuse of older people as a less common form of violence, and also mentions elderly people as being at higher risk as an intersection of socioeconomic discrimination. I read through the Domestic Family Sexual Violence Action Plan, and it references 300,000 allocated for elder abuse responses, and it references the NT Seniors policy. So I looked at that, and that's just kind of got like half a page on abuse of older people with some bullet points, none of which, well, not many of which seemed to being fulfilled at that time. And there was just, there was nothing really specific, no frameworks or policies that I could find, no data. From the national stocktake, I could see like the services that were then got funded through the national plan funding. So like those elder abuse units with police and social workers. In different states, the health justice partnerships, the mediation and counselling services, and like the pre-existing specific services as well, or things done through other streams. But in the Northern Territory, the only thing we had from this is a mediation and counselling service through Relationships Australia. This isn't to say that this is, the first project into elder abuse in the Territory. Like as I mentioned, COTA NT have produced a senior safety report in 2001. And DCLS were funded by the Office of Seniors in 2018 for an elder abuse prevention project. That also produced a report in 2019, and I found this really poignant paragraph in that. So it says that many agencies, including police, advocacy services, and medical and allied health professionals, provide support and information to people affected by elder abuse. However, no single agency in Australia has a clear role in monitoring and investigating abuse and of safeguarding and supporting adults at risk. This must change. And this report was written before the kind of implementation of the national plan. And since then, like this has changed in several states and territories with significant lasting legislative reforms and agencies created, but it hasn't changed in the Territory. There's just no data here either, other than those that have been created through surveys done by DCLS and by COTA NT. We think it's critically important to collect data on the incidence of elder abuse so that we can better understand the nature and prevalence of the problem, and to not overlook the importance of people's stories, because like other forms of abuse, the reality of it is best communicated through lived experience. So I guess I just sort of set out on this, I think, with this belief that there must already be these kind of frameworks and policies and things in place, and we were just going to like build on that. And then I found that there just isn't. Like we're mapping this and creating frameworks and generating data. So these are the things that we did in the first year of our older persons abuse outreach service. I guess they kind of fall into two categories. So we've got raising community awareness, education, outreach, and engaging with older people. And then we've got like that research, sector consultation, and building a network. So in terms of raising awareness, we started off with some media campaigns. We ran TV and radio adverts around the older persons abuse information line. And we held events for the World Elder Abuse Awareness Day. And we also just got out and about in community. So we started running, actually I'll show you that here. There's us out and about. We started doing outreach stalls at shopping centres. There's me doing that. Going along to events held by other organisations, visiting rural and remote areas, attending morning teas. I went to a lot of morning teas. Morning teas at like NT housing complexes, at seniors villages, libraries. We went along to existing social groups, University of the Third Age, Rotary, church groups, arthritis groups, craft groups. We went into residential aged care. And through all of this, we provided support, information, and referral for older people experiencing abuse. And also education sessions, some of them more structured, some of them less formal. And we distributed resources that we created. So we had an elder abuse safety toolkit, as well as we created flyers that had kind of essential services and phone numbers and things to look out for. And through all this, we were also rolling out our community survey to gauge people's knowledge and experiences. And I guess this was a bit of a learning as well. So I mean, I really thought we were going to get back more surveys than we did in the end. I kind of, we were really pushing it through all of our events and stakeholders and social media. But in the end, almost all of the surveys that we completed, we did one-on-one with one of us and an older person, going through all the questions individually. And this was like great for really getting a good understanding and for really delving into the questions and for getting really good written responses. But I guess it also meant that we didn't get quite as wide set of responses as we were hoping for. And I think the idea of this as well was just like all of this was to be really kind of reciprocal in terms of like providing information and education, but also using those opportunities as like focus groups with older people to really hear from them, like what they have been experiencing and what they think would work in the territory and what they'd like to see in the space. So on the other side, I was also reaching out to different organisations. I met with the Territory Families Faces team. They're the ones that were hosting the National Elder Helpline in the Territory. So I was hoping to kind of find out from them their statistics, what kind of calls they're getting, what kind of help they're providing. And what I actually found was that calls going through to that line were actually going through to the Northern Territory Child Abuse Report line. So people were calling the elder helpline and then waiting on hold on the child abuse line, and you can wait on hold for a long time, and hearing that child abuse recorded message, and then potentially just hanging up. And they weren't recording which calls came through that number and which calls came through the child abuse report number. So they really didn't have any statistics on how many calls they were getting. And the few calls that did make it through, they said that they were just referring them through to us at DCLS. So I also attended different networks. So we've got the Darwin Aged and Disability Services Network, the Domestic and Family Violence Network. I talked about what we were doing, that we were hoping to build a network of services to look at older persons abuse strategies for the Northern Territory. I met with individual service providers, like Domestic and Family Violence Services, hospital social workers, Dementia Australia, COTA, Relationships Australia. and talked about like kind of what sort of cases they get, what sort of numbers, what they're seeing, what barriers they're seeing in supporting people. And I guess we saw that older persons abuse cases are not often referred through to domestic and family violence services. It's not always seen as such a pressing priority as well, in terms of intimate partner violence. We reached out to police, because I was hoping to kind of involve them in these conversations and consultation. And what we kind of got back from them at that point was that they were willing to listen if we had something really concrete that we wanted to tell them to do, but they didn't really have the space to kind of be taking part in discussions and things. And of course, so at that point, like we're wanting to build this plan for the Northern Territory through all this like expertise from the sector and what we're hearing from older people. And so I didn't have anything to kind of put to them at that point. So yes, we continued without them at that point. But by the end of the first year, we were really ready to hold our first older persons abuse working group meeting. So the results of our survey in 2024 showed us that 15% of older people have experienced abuse. 58% of those who had experienced abuse said they didn't know who to contact. 48% overall said they didn't know who to contact. 91% of people said they don't think that there are enough supports or services, and 92% of people said that older abuse is a form of domestic and family violence. And the additional themes that we got back from people when we talked in more depth and asked them what their views were was that they'd like more awareness and information available in community, more education, both in schools and for services, media awareness campaigns, specific service to support older people, ways for people to report abuse, staying connected, having a safe place to go, better training for frontline staff, harsher penalties for abusers, working with elders in remote communities, checking in with people in their homes. That was a big one. People talked a lot about like community visits, and more drug and alcohol services. So in our second year, we continue to expand our outreach events and stalls and continue to connect with older people in community. And we also then, towards the end, ran a second survey. Some of those results I've already showed you at the beginning there. And we reached out to more First Nations organisations to try and hold focus groups and have discussions with them around strategies for supporting people experiencing abuse. And a big push for our second year was the Older Persons Abuse Working Group. To use, all the information that we're gathering and collecting and the expertise of the sector to create a policy directive together and a plan and put that to the Northern Territory government. So these are all the different organisations who engaged with our Older Persons Abuse Working Group. It's just been a really amazing thing to be a part of. Like, so many organisations have really put in their time and expertise and have really shown their concern and highlighted like the issues facing older Territorians. I was also contacting services in other states, explaining what we were doing, that we're trying to build this picture, trying to work out what would work here and where we can start. And, like, we didn't want to reinvent the wheel. So if they've got services that are working really well there, we want to know what works well, what doesn't work well, what we can apply in the Territory. I spoke to the senior solicitor at the Elder Abuse Unit at Legal Aid New South Wales. And she was really generous with her time and talked about like the beginnings of their service, the model that they used, its kind of beginnings through the national plan and the funding, and how they function with the New South Wales Commission, and just gave us some really good pointers of kind of where to look and what things to think about. And she sent along a social worker and solicitor to our Older Persons Abuse Working Group meeting. which was just really great. Like, I think we learned a lot from the kind of work that they do and how they work so well with banks and with the police. And they really emphasize the importance of having continuing social and legal support for positive outcomes for people experiencing abuse. So at this point, we'd sort of identified our priority areas. So we had adult safeguarding legislation and a statutory body, establishment of specific services to support adults experiencing abuse, and embedding specialist workers into services, having education and training for police and frontline workers, having culturally accessible and safe models for the Northern Territory, having primary prevention education and community education. We were also working really closely with the public guardian and trustee. They've been really vocal for some time about the need for reform and better adult safeguarding in the Territory. So at that point, we sort of merged the older persons abuse working group with an existing adult safeguarding network, and then it all became the adult safeguarding network. We had the chief adult safeguarding practitioner from South Australia attended one of our meetings as well, and that was another really great opportunity. And I think that just really drove home to us how important it is to have something like that here to really be able to help those people that aren't able to reach out for support. And that's like a really significant cohort that we're seeing. And we were also able to bring a policy officer on board, which was really great. And they were able to do like a really deep dive into all that, like the current legislation, what we do have but isn't being applied, what there is in other states that's being applied better, what they've amended, and how we can, what are the kind of changes in legislation that we're advocating for. And we wrote a collective letter as a network to the Minister for Seniors, the Minister for Health, and the Minister for Domestic and Family Violence, and outlined our concerns and invited them to attend our meeting. And the Minister for Seniors did come along to our next meeting. And so all the agencies were able to talk to them about what they're seeing and the barriers that they're facing in supporting people. And we also had Robert Fitzgerald, the Age Discrimination Commissioner, came along to one of our meetings, which was wonderful to get that kind of national overview and hear about all of the work that's being done nationally, and some tips for the Northern Territory. And yeah, no, it was at this point that we were really able to put all this together for our policy directive for the Northern Territory Government. We also responded to the draft second national plan to end the abuse and mistreatment of older people, and created an action plan for the implementation of that in the Northern Territory. And we just then continued meeting with ministers and ministerial advisors and kind of outlining what it is that we think the Northern Territory needs. So in addition to the kind of themes that we got from the 2024 survey, the additional things that people brought up in this year's survey was that they wanted continuing follow-up services. They want a dedicated police officer, counselling services, someone to talk to about rights and what to do, carer assistance, a lawyer that can continue to work with you, recognising alienation of grandparents as abuse, respite accommodation for carers, more community support from neighbours, taking elder abuse as seriously as DV, and a service to provide emotional support and real support to make it stop. I guess what we really heard from people as well is that, they just want the behaviour to stop. In many cases, they still want the relationship to continue. It's not always a matter of criminalizing behavior or seeking retribution. In some cases, the older person might see the solution as getting support for the offender, for offering drug or alcohol rehabilitation or helping with housing or employment. We also heard quite a lot about people wanting somebody in authority to talk to the perpetrator and to like put them on notice. Like, I guess that's sort of old-fashioned policing where a police officer might talk to someone and kind of let them know that what's happening is being seen, and it's not okay, but not necessarily actually taking any police action. So, we know that older people are wanting to feel safe and supported, to have increased visibility, a safe place to go, education, supports for carers, and specific services to support them that they can continue and that can continue working with them. So from all of that, we've got our list of current gaps and systemic issues in the Northern Territory. So what we know is that there's a lack of mandatory reporting. Like the threshold for legal intervention from police is really high. And so where do people, there's nowhere for people to go with reports. If somebody has concerns, they can call us for information, but there's no centralized place for reports to be collected, or for data to be created. There's no early intervention because we don't have that legislative protection or statutory body. So if somebody raises concerns, often there's nobody that can actually act on those concerns. We've got a lack of specific services for people who can reach out and want supports. There's no one-stop shop where they can get all the supports they need. They're just getting kind of bits and bobs from different places, and there's nobody to kind of coordinate or case manage their care. We don't have a state or national register for our advanced personal plans, which are the enduring powers of attorney. I've not really touched on this yet, but this is another big one for us in the Territory. So like we get cases where, say, you might have someone who has 3 adult children, all who have an advanced personal plan, all naming them as the decision maker. And any of them could take those to an agency, and there's no way of knowing which is the most recent, that there are other ones out there. So that it's just really open to abuse. We don't have enough education or primary prevention. We have a lack of clarity as to where older persons abuse sits within state and national frameworks. So it's like, is it sitting in domestic and family violence? Is it sitting in health and aging? Is it sitting in seniors? Like every state and territory is different. And it means that it's always on the periphery and it's always fallen into the gaps between government agencies and services and legislation. And we have systemic issues such as a lack of public housing, a lack of aged care beds, a lack of services in remote areas that are negatively impacting outcomes for people experiencing abuse in the Territory. So this is a summary of our key recommendations, and we go into this in more detail in our policy directive and our action plan. But as a summary, we concluded that we need to have an Adult Safeguarding Act with an Adult Safeguarding Unit that has legislative investigative powers. We need amendments to the Domestic and Family Violence Act and Criminal Code. And we'd like a specialist elder abuse liaison unit within the police, amendments to the Advanced Personal Planning Act, funding for a dedicated elder abuse legal and social service based on that social worker lawyer intervention model, and funding for equivalent services in remote communities. We want implemented targeted education and training for industry professionals, strengthening cross-sector collaboration, awareness and community education, and implementing standardized data collection, and developing more community legal education to inform the public about what to do and to inform people of their rights. And we're also working around developing legal education for people receiving carers payments. So in terms of continuing our work, the program has now been funded for another 3 years. And so, go back there. The next steps for 2025 are, so we've now taken on the National Elder Helpline for the Northern Territory. Those calls are now coming directly to Darwin Community Legal Service. We're partnering with Northern Territory Police to roll out older persons abuse training to officers and call centre staff, and we've already done that for over 200 officers and staff now that we have something concrete to tell them. We're delivering education to Services Australia and St John's staff. We're working with customer advocates from financial institutions. So they came to our most recent Adult Safeguarding Network meeting, and we're looking forward to working with them on supporting people. We're creating new resources and toolkits specifically around financial abuse this time. We're continuing to work with the network and collaborating with the sector. We're continuing outreach to older people where they are, providing education, information, referral and support. And we're going to continue advocating to the government for change. Here we go. That's the last one now. Thank you.
Oh, thank you so much, Eleanor, for such a fantastic presentations. Um, there are a few observations that I might just like to draw to your attention, as well as some questions. So Francis wanted to, I guess, make the point that, that there is also abuse by third parties, so systemic abuse
Yeah.
that relates to abuse by, sorry, I'm just trying to get this. Okay, so by nursing home, neglect, and public trustees' mishandling of finances
Yeah.
is worth noting. I'm tying that up with another observation, I believe, by Nick, that in your research, do you believe that there might be some underreporting given the sort of mistrust relationship between the police and the Indigenous or Aboriginal community?
Yes, I think that's absolutely likely that there's an underreporting. And I think that's maybe why when we're sort of surveying people in a different environment, that we're kind of building more of a picture than would necessarily come through, through police or the elder helpline previously. Due to that, I think that's a fair point.
And Linda was asking whether in the definition of paid carer, does it include inside residential care as well as home care?
Yes, yeah. So in terms of reporting, when we were mentioning like paid carers, that would be that would include in residential aged care as well. Yeah.
And as a follow-up to that, does elder abuse include nursing duties in residential aged care?
Yeah, so I guess what we've been looking at specifically is abuse from family members, which often occurs in the community rather than in an institutional setting, though it can also occur in an institutional setting. And that's kind of what the focus of this has been on. But absolutely, there is abuse that occurs in residential aged care or from paid carers. Um, and that can be reported through the Aged Care Quality and Safety Commission and to police, of course. And we can also assist people experiencing that as well. But yeah, I guess this has mainly been around that family abuse.
And as an additional, I guess, observation or comment, Sophia mentions that alienation of grandparents is occurring more often now as a way of manipulating an older person. Would your work in this space reflect that?
Yes, absolutely. And we see cases where we're sort of assisting people that are experiencing this and looking at their kind of legal options and trying to support them. And as you saw there, it was, it was brought up as one of the themes that people mentioned with the surveys. And I think, yes, it's absolutely used as well as a way to prevent people from taking action against abuse, the idea that someone's going to withhold access to the grandchildren. Yeah.
And Lydia asks whether should we consider a national working with elder people registry?
Well, certainly worth exploring. Yes. I mean, we have it in other industries. Yep. Yeah, maybe that is something we need to look at.
I wanted to, Eleanor, and I support a comment that Leo has made, that you are a committed professional and an amazing lady, and to keep up your good work to benefit all those unfortunate to be affected by elder abuse.
Thank you. That's a lovely thing to say. Thanks.
Now, Louise, on suggestion questions above, that Louise, I beg your pardon, Louise, she saw that the Australian government recently said they are progressing work on the National Worker Registration Scheme for aged care workers.
Okay.
keep note of that.
Mhm.
And Greg mentions that in Victoria, elder abuse is framed as part of family violence. This is fine, but it excludes all other forms of abuse. So people suffering for this have nowhere to go, which seems to reflect, I guess, what you're discovering.
Yes, I think that's right. Like, I think a thing for us is that we sort of started off thinking like, why is older person's abuse being siloed separately to domestic and family violence? Like, why are that not always necessarily seen as the same solutions or funding streams even or services? But kind of what we learned along the way is that although absolutely some cases really require that police and domestic and family violence response, other cases where people can't engage with services really need that safeguarding, and other times people need that counseling, mediation, ongoing support. So it's a bit more varied as to the kind of supports that people require.
Yes, and we've got quite a number of commentary from the audience. Diana, for example, is really appreciating the presentation that you've delivered, and it's given people a lot of things to think about. As a just a very quick commentary from me from South Australia, as you've identified, we have the adult safeguarding unit in South Australia, but the journey that we went through in this state started off with a non-funded alliance that we call the Alliance for the Prevention of Elder Abuse, that consisted of 5 primary members, which was the police, public trustee, public advocate, the Age Rights Advocacy Service, and the Legal Services Commission of South Australia. We were seen as the organisation of last resort, and we lobbied the government for the adult safeguarding unit. So that was the journey that occurred in South Australia that took at least a decade. I am mindful of time, and there's no other questions that I can see on the chat line. So I would like to formally thank you, Eleanor, for your presentation today and sharing the details of DCLS work in the Northern Territory. It's really making all of us think about this. Thank you also to everybody who has joined us this afternoon. And there are a lot of engagement that I can see from the chat line. So people are very interested in this space. The link to this recording will be distributed to everyone who registered, and it'll also be published on the EAAA website and on our YouTube channel. Now, the lunch and learn sessions are now held monthly, so please join us again in November as we hear from the Elder Mediation Australasian Network in November. So thank you all. Fantastic comments, fantastic presenter, and I wish you all a very good afternoon.